Today I'm going to have an intern sitting with us to watch and maybe pitch in a little bit. Is that okay with you?
Yes, of course.
Okay, perfect. So, how are you feeling today?
I'm not feeling great.
What are your symptoms?
I'm experiencing several pain in my lower leg I've gotten from a terrible accident.
I noticed that the pain was located in the inferior part of the leg by the way she was walking in as she limped. We should get an x-ray to check for internal injuries.
Okay, so I think that you may have a distal tibia fracture. Intern, may you explain what that means to the patient so she can understand?
Yes, of course. Distal refers to parts of the body that are away from the center of your body.
What exactly is the center of my body called?
The center of your body is referred to as medial. An example is that the chest is medial to the arm.
All right, so I will set up an appointment for your x-ray. Is there any other pain that you're feeling?
Feeling pain all over my body.
Oh, all right. So what I'm going to do is have you stand in the anatomical position, please.
What is that?
So the anatomical position is I'm going to have you stand up and face forward, arms down by your side, and I'm going to have your palms facing forward. And also I'm going to want you to have your feet facing forward as well.
Alright.
So where do you feel the most pain?
On my chest and my lower back posterior to my hip.
All right. So I'm going to check your hips after. And first I'm going to check your chest. All right. So I see that you have a big bruise on the superficial part of your chest, which is closer to your head, making it the superior end of the body. Your chest is also part of the thoracic cavity, which is a part of the anterior ventral cavities.
What does my third cavity consist of? Also, what is the super meaning?
Okay, so your thoracic cavity includes your esophagus, heart, lungs, trachea, large blood vessels, and nerves. This area is protected by your lungs. Also, the superficial is meaning that your bruise is on the surface of your body.
Where do you think the burns come from? It hurts to breathe and cough.
Well, I think that the issue could be a puncture deep in your lungs.
I also would like to mention that she had told me about her upper leg around with her pelvis hurting a lot. I believe that the femur end is proximal to where the pelvic bone joins together.
Wow, I'm impressed you got all that information and was able to explain that. Now, can you tell me what happened in your car accident?
Yes, as I was driving, someone hit me on my side of the car and my door crushed and hit my kernel as I rolled and upside down. All the injuries came along with my missing tooth from me hitting the wheel.
Oh, yes, you lost a tooth in the buccal cavity, but more importantly, you hit your head?
Yes, but what does the buccal cavity mean?
If I could pitch in, the buccal cavity is part of your mouth, like gums, teeth, or tongue.
So, where does your head hurt?
It hurts near my forehead, close to my nose.
So you're saying that you are experiencing pain in your dorsal cavity as well as the nasal cavity?
I think so. Can you define what those exactly mean?
Yes. So the dorsal cavity is the posterior or upper portion, not the lower portion, that houses your spine, which is the vertebral canal. Also, your nasal cavity, it just simply is the space above and behind your nose, which is located in the midline of your head.
Oh, okay. Can you now please look at my toe? It's throbbing. Oh, also my stomach. I can't move around very.
Yes. Can I have you take a seat on the bed so I can check? So before checking your wrist, I am going to check your toe that is lateral to your foot that you have wrapped up.
To clarify, lateral means that the toe is away from the midline of your foot.
Oh, okay.
So I can see that it is definitely broken, but I will have to do x-rays just like everything else. Now let me see your abdominal cavity.
The abdominal cavity is just another word for the stomach, but also other important organs like your liver, kidney, and colon.
Okay, thank you. You probably noticed that I did not understand the word by the look of my face.
Let's look over all this information I've written down here and come back and get you ready for x-rays so that they can be done today.
Oh, okay, thank you.
So we have a patient complaining of pain in their pelvic cavity, which is around the lower portion of the transverse plane.
So we are looking for injuries around the reproductive organs, bladder, and rectum.
Yes, we are going to take some tests right now to see what's going on. So unfortunately, we are going to have to bring you into the surgery room to open up your stomach and fix the issues that you're feeling.
Yes, so we are cutting down your median plane through your abdomen.
Yes, correct. We are going to look through all of your abdominal quadrants and find the problem.
May I ask what the median part of my body?
Yes, so the median is the plane splitting your body from right and left. We are going to want to set up the surgery in about an hour to be safe.
The opposite of the median plane is the frontal plane. This plane divides the body from front and back.
So we will be focusing on the left and right areas of your abdomen.
Oh, her abdominal quadrants?
Yes, we will look through them during the surgery. This patient has a little tumor growing in her liver, but also she needs to get her appendix removed, all coming from the abdominal regions.
So the liver is located in the left upper quadrant and the appendix is located in the left lower.
You almost got it. The liver is located in her right upper quadrant and the appendix is located in her right lower quadrant. You have to make sure you know these so you don't cut in the wrong part.
How can I remember it?
You can remember by putting your body in the patient's perspective and knowing the quadrants are split up between the median and the transverse plane.
Okay, thank you. I'm gonna...
The little tumor is growing in her liver, but also she needs her appendix removed. And these are all coming from her abdominal regions. The liver is located in the left upper quadrant, and the appendix is located in her left quadrant. But no, they're not. Her liver is located in her right upper quadrant, and her appendix is located in her right lower quadrant. You can remember these by knowing that the quadrants are split between the median and the transverse planes. Help!
Oh my gosh, we need to get to the emergency room.
It looks like she has suffered from a quadril injury when she fell.
Yes, the quadril is pertaining to the back side.
Her fall caused us to see that she has a cancerous tumor in her pancreas that has spread to her large intestines, covering her left upper and lower abdominal quadrants.
Were there any symptoms that you noticed from her?
Well, she was complaining recently about discomfort in her eyes and the orbital cavity, also pain in her dorsal cavity area of her stomach.
So pain in her abdomen on her belly?
Yes, she complained about pain, but we assumed it was just from a diet change.
She seems to be having symptoms of pancreatic cancer. All these areas of pain seem to be coming from the abdominal region.
Yes, the liver, small and large intestine, stomach, all parts of the abdominal regions. We're going to have to get her to the x-ray room to see what the issue is.
Oh, now I see that she has twisted her hip in the ventral part.
I know for a fact that we're going to have to cut into her ventral cavity and take out the cancerous area.
Yes, we are going to need to get x-rays and think of this clearly since she's an intern and it's very important that we take care of her. So the nurse and I
Yes,
have
of
both
course.
decided that after the x-rays it would be the best option to go into surgery to fix the situation.
Okay, I trust what you have to do.